ന്യൂസിലൻഡ് നേഴ്സ് ഡയറീസിന്റെ മറ്റൊരു വീഡിയോയിലേക്ക് എല്ലാവർക്കും സ്വാഗതം. സോ CBT എക്സാം ക്വസ്റ്റ്യൻ ആൻഡ് ആൻസേഴ്സ് ഡിസ്കഷൻ സീരീസിന്റെ 4ാമത്തെ എപ്പിസോഡാണ് ഇപ്പോൾ നിങ്ങൾ കണ്ടുകൊണ്ടിരിക്കുന്നത്. സോ ന്യൂസിലൻഡ് നഴ്സിംഗ് കൗൺസിലിന്റെ ഓൺലൈൻ തിയറിറ്റിക്കൽ എക്സാമിന് ഫ്രീക്വൻ്റ്ലി അല്ലെങ്കിൽ കോമൺലി ചോദിച്ചുകൊണ്ടിരിക്കുന്ന ഡിസീസ് കണ്ടീഷനെയും അതിനെ റിലേറ്റ് ചെയ്തിട്ടുള്ള ക്വസ്റ്റ്യൻ ആൻഡ് ആൻസേഴ്സ് ആണ് ഞാൻ ഈ ഓരോ വീഡിയോയിലും നിങ്ങളുമായിട്ട് ഡിസ്കസ് ചെയ്യുന്നത്. സോ ഈ വീഡിയോ മുഴുവനായി കാണാനായിട്ട് നിങ്ങൾ ശ്രമിക്കുക. So let's move to the video. സോ ഇന്നത്തെ വീഡിയോയിൽ ഞാൻ 4 കാര്യങ്ങളാണ് ഡിസ്കസ് ചെയ്യുന്നത്. ഒന്ന് പ്രീ ഓപ്പറേറ്റീവ് കെയർ, ദെൻ പോസ്റ്റ് ഓപ്പറേറ്റീവ് കെയർ, ദെൻ പോസ്റ്റ് ഹിസ്റ്ററക്ടമി കഴിഞ്ഞിട്ടുള്ള പേഷ്യൻസിന് റിലേറ്റ് ചെയ്ത് ചോദിക്കുന്ന ക്വസ്റ്റ്യൻസ്, ദെൻ പോസ്റ്റ് ഹിപ്പ് ആൻഡ് ജോയിൻറ്റ് സർജറി കഴിഞ്ഞിട്ട് ചോദിക്കുന്ന ചില ക്വസ്റ്റ്യൻസ്. സോ ഈ 4 ടോപ്പിക്സ് ആണ് ഞാൻ ഇന്നത്തെ വീഡിയോയിൽ നിങ്ങളുമായിട്ട് ഡിസ്കസ് ചെയ്യുന്നത്. So the first question is, what all are the steps we usually do if a patient posted for a surgery? So we need to check the observation or vital signs. We need to check weight of the patient. Then we have to ask the medical history, the allergic history. Then we need to take an ECG if the patient's age is above 50 or if he or she has history of cardiac problems. Then if the patient has any history of a respiratory problem, then we have to ask for a chest x-ray. And also we need to get a consent as well. So why should we weigh the patient before the surgery? So the answer is for right dosage calculation. So for right dosage calculation, we need to know the weight of the patient. Then the next one is why we need to keep the patient nil by mouth. So the answer, to reduce the risk of aspiration of stomach content during the surgery. To reduce the risk of aspiration of stomach content during the surgery, we need to keep the patient nil by mouth. The next question is, the patient was positive for surgery tomorrow but has been fed. So what will be your action? We need to inform the theatre and also the surgeon as well. Okay, so that's the answer. The next question is, patient and husband anxious about pain following surgery. So the answer is, we need to educate the patient and husband the importance of pain relief and provide a reassurance. The next question is regarding pre-medication. Why should we give pre-medication before surgery? So the answer is to prevent nausea. So we usually give antiemetics before surgery. Why is anticoagulant prescribed? So anticoagulants are usually prescribed post-operatively to prevent deep vein thrombosis. Then which exercise do you teach pre-operatively? We usually teach the patient about deep breathing exercise. So that's all about pre-op care question, and now we are moving on to post-op care. So priorities in PACU. PACU means a post-anesthesia care unit. What to assess first when you receive a patient in PACU? So we need to check airway first, then ABC, breathing, circulation. So check the surgical site for bleeding or draining. Then check if there is any, check the drain site. If the patient has any drain, then check the rate of IV fluids, the medication was given, then circulation, sensation extremities after anesthesia. So that's all the initial assessment usually the nurses do. Then how do you know a patient is ready to transfer from OT to PACU? So the surgery is over, and how do you know if a patient is ready to transfer from theatre to post-operative care? So the first sign is if the orbs are stable, then that's one of the important signs. Then if the surgical site dressing is intact, there is no oozing, and the patient is alert, no nausea, vomiting, then we can move the patient from theatre to PACU. Then when is the patient ready to leave PACU and transfer to ward? So if the patient's observation is stable, if the surgical site dressing is intact, there is no oozing, if the patient is alert, there is no nausea and vomiting, and the pain is under control, then we can transfer the patient from PACU to the ward. Next question is causes of dizziness after prolonged bed rest. So definitely the blood pressure will drop. So the main reason is postural hypertension or orthostatic hypotension. Then what are the dangers or what are the complications of immobility? Muscle tone loss, DVT, pneumonia, pressure injuries, constipation. That's all are the common complications of immobility. Then why we use TED stockings postoperatively? So the reason is to prevent deep vein thrombosis. Then why we use anticoagulant postoperatively? So the answer is to reduce the risk of developing a DVT or PE. Okay, so to reduce the risk of DVT or PE, we usually give anticoagulant postoperatively. So what is the side effect of anticoagulants? So bleeding, rashes, then diarrhea, vomiting, nausea, dizziness. That's the common side effects of anticoagulants. So bleeding is the major one. So if the patient's temperature spike after the third day of surgery, so what are the steps you need to do? Okay, so it's maybe used it may be due to an infection. So you need to check the wound side or the drain side. Then you need to report the doctor, and also need to collect blood culture. Administer antibiotics as prescribed. If the woman bed rest after the surgery, what all the activity or exercise you will suggest to her? Deep breathing and cuffing exercise, Kegel or pelvic floor exercise you can teach to the patient. The husband is asking what is happening with his wife. So what's your step or what's your role? So you need to provide reassurance to him, and also you need to explain what is happening with his wife. Then the patient is refused to take Lexin postoperatively. So what you are going to do with it? So you need to ask why. Okay, you need to ask why the patient is refusing the medication, and you need to explain the importance of anticoagulation or anticoagulants, and also respect the right to refuse medication. Okay, so you need to ask why she is refusing the medication, then educate the importance, and also respect the right to refuse medication. Okay. And patient doesn't want to cough because of pain. So what is your role? So you need to give some pain medication or pain management first, then educate and encourage to do coughing exercise. Okay, so first we need to address the pain. So we need to give some pain medication, then educate and encourage to do the exercise. Then the next question is, what is minimum amount of urine expected? So for an adult, it is 0.5 ml per kg per hour. That means 30 ml per hour. ഇതൊരു എന്നിട്ട് ഡെഫിനറ്റ് ആയിട്ട് ചോദിക്കുന്ന ഒരു ക്വസ്റ്റ്യൻ ആണ്. സോ മറക്കാതെ നിങ്ങളിത് ഓർത്തിരിക്കണം. ഫോർ അഡൾട്ട് ഇറ്റ് ഈസ് 0.5 ml per kg per hour ആണ്. ദാറ്റ് മീൻസ് 30 ml per hour. So what are your primary concerns during the first 24 hours? Pain management, encourage mobility, prevent DVT and pulmonary embolism. Why are older people more prone to postoperative complication? It's due to low metabolism, high risk for pressure areas and infections, lung complications, high risk for DVT. So these are the reason why the older people more prone to get possible complications. What all are the readings you are going to record in a fluid balance chart? Not only urine output, drain output, feces output. Then if the patient is sweating, then we have to record that as well. Okay, so these are all the recordings we usually record in a fluid balance chart. So the next topic is hysterectomy. Okay, so now we are going to look into the difference between the total and radical hysterectomy. In total hysterectomy, the surgeon removes the whole uterus and cervix, whereas in radical hysterectomy, they remove tissues on the side of the uterus, cervix, and the top part of vagina. Okay, so there is some difference between the total and radical. So in the radical hysterectomy, they remove tissues on both sides of the uterus or on the sides of the uterus and the cervix and the top part of the vagina. Whereas in total hysterectomy, they remove the whole uterus and the cervix. Okay, so the question related to hysterectomy. So the first question is reason for increased risk in post-op. So the reasons are pain, anxiety, hypoxia, early warning sign for developing sepsis, DVT, PE. Okay, so these all are the reasons for increased respiratory rate in post-op patients. Next question is, what do you do when woman wants to keep the uterus? So the answer is clearly document in the surgery form and hand over to the theater staff, and also educate and explain the procedure and the expense as well. Okay. The next question is handling of the bowel causes. So post hysterectomy, there is a high chance of paralytic ileus. That means obstruction of the intestine due to paralysis of the intestinal muscles. Okay. Why is Clexane used after hysterectomy? So this is to prevent DVT, thrombin formation, or embolism. Okay. Then why is Clexane given subcut or not IM? So I have already talked about it in the earlier video. So this is to prevent any bleeding or muscle bleeding or bleeding into the muscle. Okay. Then the next question is, woman is in pain but haven't used the PCA for 7 hours. So what you will do? You need to educate her about the PCA and encourage her to use when she's in pain, and you need to check for nonverbal signs of pain as well. Okay, so you need to educate her about the PCA and need to encourage her to use PCA when she's in pain, and also look for any nonverbal sign of pain as well. Then if the patient husband is extremely anxious, then what you are going to do with it, how you are going to deal with it, you need to reassure him. Okay, you need to provide reassurance to him. So the reason for shallow breathing after abdominal hysterectomy. So morphine can cause shallow breathing. Pain and limited mobility also can cause shallow breathing. So we are talking about post-hysterectomy patients. Okay, so how we are going to mobilize the patient first time. So we need to give support to abdomen and ask them to move slowly and ask them to roll onto side to prevent uterus bleeding. So that's all about a hysterectomy. So now we are moving on to hip joint replacement. So the patient is too anxious preoperatively. So what's your response? You need to explain the pre-op, post-op, and also the procedure to the patient. So this can reduce the anxiety in patients. Okay, so we need to instruct the patient to not cross the legs and not to lie on his operation side, or place pillow between legs and lie on good side. Okay, lie on to good side. That are the instruction you need to tell. So what is the purpose of wound drain post hip joint replacement? So it helps to drain excess post-operative blood from wound side. Okay, so it helps to drain excess post-op blood from wound side. So that's all about today's topic. So ഇന്നത്തെ വീഡിയോ നിങ്ങൾക്ക് കുറച്ചെങ്കിലും ബെനിഫിഷ്യൽ ആയിട്ട് തോന്നിയെങ്കിൽ പ്ലീസ് ലൈക്ക്, ഷെയർ ആൻഡ് സബ്സ്ക്രൈബ് മൈ ചാനൽ. സോ അടുത്ത വീഡിയോയിൽ കാണുന്നതുവരെ എല്ലാവർക്കും ബൈ.